Why you feel dizzy after 50. You stood up from your chair this morning, and the room spun. Or maybe it happened when you turned your head too quickly. Or stepped off the bottom stair. Or got up from bed in the middle of the night and had to grab the wall just to stay upright. You've been brushing it off. I must have stood up too fast. I didn't drink enough water. I'm just getting older. But here is something that almost no one tells you. Dizziness after 50 is one of the most misunderstood, misdiagnosed, and dangerously overlooked symptoms in older adults. And in many cases, the real cause has nothing to do with what your doctor checked for at your last visit. Today, we are going to change that. In the next 15 minutes, I'm going to take you deep into the hidden causes of dizziness after 50, the ones that most doctors don't have time to explain, and that most patients never think to ask about. We'll talk about your inner ear, your blood pressure, your nervous system, your nutrition, and one surprising hidden cause that affects millions of people over 50 who have no idea it's happening to them. And most importantly, I'll tell you what you can actually do about it. This is an educational video. It is not medical advice. If you are experiencing frequent, severe, or sudden dizziness, please see a doctor immediately. But knowledge is the first step, and what you learn today could make a real difference. Let's begin. What is dizziness, really? Before we talk about causes, we need to get one thing straight, because dizziness is actually not one single thing. It's a word people use to describe several very different sensations. And knowing which type you have is the first step toward finding out why. Type 1 is called vertigo. This is the spinning sensation, the feeling that you or the room around you is rotating even when you're completely still. It's often sudden. It can be triggered by moving your head. And it can come with nausea, vomiting, and a feeling of absolute helplessness. Type 2 is called presyncope, or near fainting. This is the lightheaded, wobbly feeling you get when you stand up too quickly. The world doesn't spin, it just goes gray at the edges. Your legs feel weak. You might feel like you're about to pass out. Type 3 is called disequilibrium. This is the feeling of being off balance. Not spinning, not fainting, just unsteady. Like the ground beneath you is slightly tilted, or you can't quite trust your legs to take you where you want to go. And type 4, which is often overlooked, is a vague, floating, foggy dizziness that doesn't fit neatly into any category. People describe it as feeling not quite right, or not fully here. Each of these types has different causes. And understanding the difference matters enormously, because a vertigo episode from your inner ear is treated completely differently from lightheadedness caused by blood pressure. So as we go through the causes today, think about which type of dizziness matches your experience. It's a clue your body is giving you. The inner ear. Now let's talk about the hidden cause that the title of this video is pointing to, the one no one talks about, and the one that I believe is responsible for a huge percentage of dizziness episodes in people over 50. It's called BPPV, benign paroxysmal positional vertigo. I know that's a mouthful. Let me break it down. Benign means it is not dangerous or life-threatening on its own. Paroxysmal means it comes in sudden, brief episodes. Positional means it is triggered by specific head movements or positions. Vertigo, you already know. So BPPV is a condition where certain head movements, turning over in bed, looking up, bending down, tilting your head, trigger sudden, intense spinning that lasts anywhere from a few seconds to about a minute. Here is what's actually happening in your body. Deep inside your inner ear, there are tiny fluid-filled canals that help your brain understand where your head is in space. And inside those canals, there are even tinier crystals, called otoconia or ear rocks, made of calcium carbonate. Their job is to detect gravity and motion. Now, under normal circumstances, these crystals sit in a specific part of the inner ear. But after age 50, especially in women after menopause, and in people who've had head injuries, inner ear infections, or long periods of inactivity, these crystals can break loose. When a loose crystal tumbles into one of the fluid-filled canals where it doesn't belong, it sends a false signal to the brain. The brain suddenly thinks the head is moving when it isn't. Your eyes start to rapidly flicker, a reflex called nystagmus, and you feel a violent, terrifying spinning sensation. And then, just as suddenly as it started, it stops. Usually in under a minute. Which is why so many people dismiss it and never seek treatment. Here is the most important thing I want you to hear today. BPPV is one of the most treatable conditions in all of medicine. There is a simple, non-invasive physical maneuver, called the Epley maneuver, that a trained doctor or physical therapist can perform in their office in about 5 minutes. It literally repositions those loose crystals back where they belong. Studies show it works in more than 80% of cases, often in a single session. But here is the tragedy. The vast majority of people with BPPV never get this treatment. They go to their doctor complaining of dizziness, get told it's just aging, or given medication that doesn't address the root cause, and continue to suffer for months or years, completely unnecessarily. If you experience brief spinning triggered by head movements, you may have BPPV. Ask your doctor specifically about it. Ask about the Epley maneuver. It could change your life. The second major cause of dizziness after 50 is something called orthostatic hypotension, and it's far more common than most people realize. Let me describe it and see if it sounds familiar. You're sitting comfortably, or lying down. You stand up, and for a few seconds, sometimes up to 30 seconds, the world goes gray. You feel lightheaded. Your vision darkens at the edges. Your legs feel weak. You might grab something nearby just to steady yourself. Then it passes, and you go about your day. This is orthostatic hypotension, a sudden temporary drop in blood pressure when you change positions. And here is why it happens. When you're sitting or lying down, blood naturally pools in the lower body, in the legs and abdomen. When you stand up, your body needs to quickly redistribute that blood upward to keep your brain supplied with oxygen. Normally, your nervous system handles this automatically and instantly. But after 50, this reflex slows down. The blood vessels in the legs are slower to constrict. The heart is slower to compensate. And for those few seconds before your system catches up, your brain is briefly starved of blood flow. Several things make this worse. Dehydration, which is extremely common in older adults. High blood pressure medications, especially diuretics and alpha blockers, which are among the most commonly prescribed drugs in people over 50. Diabetes, which damages the nerves that control blood vessel reflexes. Long periods of bed rest or inactivity. And simply aging itself. The fix often involves simple lifestyle changes. Rising slowly from sitting or lying positions, drinking more water, reducing alcohol, timing medications carefully. But the first step is recognizing what's happening, and telling your doctor so they can review your medications. Now here is a cause of dizziness that is staggeringly common after 50, and almost never discussed: chronic, low-grade dehydration combined with electrolyte imbalance. Here is something most people don't know. As we age, our sensation of thirst decreases significantly. The brain's thirst mechanism becomes less sensitive. So older adults can be significantly dehydrated, losing the fluid balance their bodies need, without ever feeling thirsty. At the same time, many people over 50 are taking medications, blood pressure drugs, diuretics, certain diabetes medications, that actively pull water and minerals out of the body. The result is a chronic, ongoing fluid and electrolyte deficit that the person has no idea they have. And dizziness is one of the earliest and most consistent symptoms. Here's the science. Your brain floats in cerebrospinal fluid. Your inner ear canals are filled with fluid. Your blood vessels maintain pressure through fluid volume. Your nerve cells fire through the movement of electrolytes, especially sodium, potassium, and magnesium. When fluid levels drop, when electrolytes go out of balance, every single one of these systems is affected. Sodium is critical. Low sodium, a condition called hyponatremia, is one of the most common electrolyte disorders in older adults, and its primary symptom is dizziness, along with confusion, headache, and nausea. Magnesium deficiency, also extremely common after 50, affects the inner ear directly. Studies have linked low magnesium to increased dizziness, tinnitus, and vestibular dysfunction. The action step here is simple. Drink more water than you think you need. Aim for 6 to 8 glasses a day. Eat foods rich in potassium and magnesium. Leafy greens, bananas, avocados, nuts, seeds. And if you're on diuretics, talk to your doctor about electrolyte monitoring. This single change, proper hydration and mineral balance, resolves dizziness for many people over 50 who never suspected it was the cause. Now we come to a cause that is deeply connected to the mission of this channel, and one that I believe is responsible for far more dizziness after 50 than anyone acknowledges. Blood sugar instability. Both high blood sugar and low blood sugar can cause dizziness, but they feel different, and they happen for different reasons. Let's start with low blood sugar, hypoglycemia. This can happen when someone skips a meal, waits too long between eating, or eats a high carbohydrate meal that causes a rapid insulin spike followed by a crash. When blood glucose drops too low, the brain, which runs almost entirely on glucose, begins to panic. The symptoms include lightheadedness, shakiness, heart palpitations, sweating, and that classic dizzy, not all there feeling. After 50, this becomes more common because insulin regulation becomes less precise. Blood sugar spikes higher after meals and drops lower between them. Meals get skipped. Portion sizes change. And many people have undiagnosed prediabetes or type 2 diabetes that causes wild blood sugar swings they don't know are happening. Now high blood sugar, hyperglycemia, causes a different kind of dizziness. Over time, elevated blood sugar damages the tiny blood vessels in the inner ear, the same vessels responsible for keeping the cochlea and vestibular system healthy. It also damages the peripheral nerves that help the brain understand balance. And it affects blood pressure regulation. All of this adds up to a profound, multifaceted dizziness that doctors often struggle to trace to a single cause, because the root is in the metabolic system, not the ear. If you experience dizziness after meals, between meals, or upon waking in the morning, blood sugar is absolutely worth investigating. Ask your doctor for a fasting glucose test and an HbA1c. The results could explain symptoms you've been struggling with for years. Here is a cause of dizziness that very few doctors proactively discuss with their patients, even though it affects millions of people over 50 every single day. Medications. In the United States alone, the average person over 65 takes 5 or more prescription medications daily. Many of these drugs list dizziness as a side effect. Some of them cause it directly. And when multiple medications interact with each other, the dizziness can become severe and persistent. Yet the connection is almost never made by the patient because they simply assume the dizziness is from aging. Let me walk you through the most common culprits. Blood pressure medications, particularly diuretics, beta blockers, calcium channel blockers, and ACE inhibitors, can lower blood pressure too much, especially in the morning or after physical activity. The result is exactly the lightheaded, near-fainting orthostatic hypotension we discussed earlier. Benzodiazepines and sleeping pills, including widely prescribed drugs for anxiety and insomnia, affect the cerebellum, the part of the brain responsible for balance and coordination. Even at prescribed doses, these drugs impair balance and contribute heavily to the dizziness and fall risk in older adults. Antidepressants, particularly SSRIs and SNRIs, can cause dizziness, especially when starting treatment or changing doses. Many people don't associate a new dizziness with a medication change that happened weeks earlier. Antibiotics from a class called aminoglycosides, used to treat serious infections, are known to be ototoxic, meaning they can damage the inner ear permanently. And antihistamines, including common over-the-counter allergy medications, affect the vestibular system directly. What should you do? Make a complete list of every medication and supplement you take, prescription and over-the-counter. Bring that list to your doctor and specifically ask, could any of these be contributing to my dizziness? You deserve a real answer to that question. And if your doctor dismisses it without reviewing the list, it's worth seeking a second opinion. Now here is a cause of dizziness that almost nobody outside of specialized physiotherapy knows about, and yet it may be one of the most underdiagnosed causes of dizziness in people over 50. It's called cervicogenic dizziness, and it comes from your neck. Here's the anatomy. Your cervical spine, the 7 vertebrae in your neck, is packed with specialized nerve receptors called proprioceptors. These receptors are constantly sending information to your brain about where your head is positioned in space, how it's moving, and at what speed. Your brain uses this information, combined with signals from your inner ear and your eyes, to build a complete picture of your position and movement. This three-way communication system is what allows you to walk, turn, bend, and move through space without falling over. Now here is what happens with age, especially after years of desk work, looking at screens, poor posture, or old neck injuries. The muscles and joints of the cervical spine become tight, restricted, or arthritic. The proprioceptors stop sending accurate signals. The brain receives conflicting or incomplete information about head position. The result: a persistent, low-grade dizziness, often described as a foggy, unsteady sensation, usually worse after sitting at a screen for a long time, or when turning the head, often accompanied by neck pain, headaches, and tension across the shoulders. Cervicogenic dizziness is treated very differently from inner ear dizziness. It responds well to vestibular physiotherapy, cervical mobilization, specific neck stretches, and postural retraining. If your dizziness is accompanied by neck tension, worsens when you've been at a screen, or feels more like unsteadiness than spinning, the neck is worth investigating. A physiotherapist who specializes in vestibular rehabilitation can evaluate this in a single session. Before we get to the action steps, there is one more cause I want to address, because it is real, it is physiological, and it is very often missed or dismissed. Anxiety and chronic stress. The connection between the nervous system and dizziness is profound and bidirectional, meaning anxiety can cause dizziness, and dizziness can cause anxiety. Each one feeds the other in a cycle that can be very difficult to break. Here's the physiology. When your nervous system is in a state of heightened alert, what we call the sympathetic or fight or flight state, your breathing becomes shallower. Shallow breathing reduces carbon dioxide in the blood, which causes the blood vessels to constrict slightly. This reduces blood flow to the brain and inner ear. And reduced blood flow to the brain produces exactly the floating, foggy, unreal sensation that many anxious people describe as dizziness. On top of this, anxiety causes chronic muscle tension in the neck and shoulders, which we now know can directly contribute to cervicogenic dizziness. And the hypervigilance of an anxious nervous system makes every small sensation, every slight wobble, every brief lightheadedness, feel threatening and magnified. After 50, anxiety often shows up differently than it did in younger years. It may feel less like obvious worry and more like a persistent state of tension, restlessness, and physical symptoms, including dizziness. If stress and anxiety are part of your life, and they are for most people over 50 navigating health changes, life transitions, and the challenges of aging, this connection is worth taking seriously. Breathwork, mindfulness, gentle exercise, and sometimes professional support can break the cycle and dramatically reduce dizziness in people where anxiety is a contributing factor. Let's bring everything together. We've covered 7 important causes of dizziness after 50 today. 1. BPPV, loose crystals in the inner ear causing positional spinning. Highly treatable with the Epley maneuver. 2. Orthostatic hypotension, blood pressure dropping when you stand up, often linked to medications and dehydration. 3. Dehydration and electrolyte imbalance, especially sodium, potassium, and magnesium deficiency. 4. Blood sugar instability, both low blood sugar crashes and the long-term damage of high blood sugar. 5. Medications, one of the most underappreciated and easily addressed causes. 6. Cervicogenic dizziness, from the neck, treated with physiotherapy and posture work. 7. Anxiety and nervous system dysregulation, real, physiological, and very treatable. Now, here is the most important thing I want you to take away today. Dizziness after 50 is not something you have to simply accept. It is not an inevitable part of aging. It is a symptom, and symptoms have causes. And in most cases, those causes can be found and addressed. Talk to your doctor. Be specific. Use the language you learned today. Ask about BPPV and the Epley maneuver. Ask your doctor to review your medications. Ask for a blood sugar test, an electrolyte panel, and a blood pressure check done both lying down and standing. You are your own best advocate. The more clearly you can describe what you feel, when it happens, and what triggers it, the better chance you have of getting the right diagnosis and the right help. If this video helped you understand your dizziness better, please share it with someone you care about. A parent, a sibling, a friend who's been living with this and doesn't know why. And subscribe to Senior Nutrition Secrets for more videos every week on the health topics that matter most after 50. We cover blood sugar, nutrition, inflammation, brain health, energy, and everything in between, all in plain, honest language that actually helps. Take care of yourself. You deserve to feel steady, strong, and well at every age.